pause for 5 to 10 seconds and you can start, sir.
Am I audible? Am I clear?
Yes, sir. Go to slideshow mode, sir.
A very good evening to one and all. In the first place, I'd like to thank all the participants who have taken their time off and who are really interested in knowing about glaucoma. And I'll also like to thank Santon Pharma, who takes this initiative regularly. They did a talk on World Sight Day where I spoke about how to preserve good vision and how to have a healthy lifestyle so that you have good vision throughout your life. And today, now being the World Glaucoma Week, which is from March 7th to 23rd, Santon has taken this initiative to basically tell us about the disease called glaucoma, which is also known as the silent thief of sight. Now, why is it known as the silent thief of sight? Because most of the times, patients who have glaucoma don't know they have glaucoma. And it is only in the end stage when they realize they have glaucoma, but at that stage it is too late and they would have lost almost 70 to 80% of their vision. This is the reason why the glaucoma is called silent thief of sight. Now I'll just brief you about the disease and its various the symptoms of these disease and how do we treat this disease. I'll just go through it one by one. So what is glaucoma? Glaucoma is the name given to a group of eye diseases where the optic nerve is damaged. The optic nerve is found at the end of the eyeball, and it is very important as it carries all the information from the eye to the brain. It can be compared to a camera, like a camera, right? A camera captures images, and when you want to transfer these images to your computer, you need a cable or a cord to transfer these images to the computer. The optic nerve is just like that cord of the which transfers the images which are seen by the eye to the brain. And hence, if it is damaged, then we are not going to see any image or we are not going to perceive any image. And this is the most important structure of the eye. And this, once damaged, is irreversible. So it is very, very important that if a person has glaucoma, he has to get treated on time. And if he is treated on time, he can preserve his vision throughout his life. So what is intraocular pressure or eye pressure? Basically, just like the wheels of a tire, which has air inside that, and air is required to maintain its shape. Hence, the wheel works. So whenever we ride a cycle, if the air pressure is good, we can ride the cycle well and the wheel works. Similarly, the eye also has to have a minimal intraocular pressure. And this normal intraocular pressure is between 11 to 22. So if it is too low, then the eye will become too soft. That usually happens due to injury. And if it's too high, then the patient will have some symptoms, and hence this causes compression on the optic nerve, and this reduces their vision slowly. So the optimal eye pressure which has to be maintained is between 11 to 22. It is very, very important. So a little bit of eye pressure is essential, as I told you, for good eye health. Without any pressure, the eye would collapse like a punctured tire. That's why the eye has a pump mechanism which produces a little bit of fluid. So there, the fluid is produced at one place and it goes out of the eye from the another place. So basically, it is the inflow and the outflow mechanism which makes sure that the fluid which is secreted inside the eye, which is known as the aqueous, maintains a good eye health. You can compare this to the saliva or the which is produced in our mouth. Now, saliva is required to keep our tongue and our mouth wet. At the same time, it is also required to make sure that our mouth is clean, it is free of microbials. So similarly, there's a fluid inside the eye called the aqueous, which is required to make sure that the nutrition of the eye is maintained. It is produced at one spot, it maintains the nutrition of the eye, and it goes out of the eye from another area. It is called the angle through which it exits the eye. So how does the pressure build up? I can give you a very simple example of a tap or a faucet. So once the tap is open, there is fluid which fills up in your wash basin, and then there is a drainage pathway which makes sure that whatever fluid is accumulated is cleared through the drainage pathway. Similarly, the eye also has an area called the ciliary body, which is just behind the iris, which is most of the times brown in most of Indians. So this fluid is produced behind the iris. It passes from in front of, from behind the iris to the front part of the eye, and then there is a small drainage system which is known as the angle. Now the angle is present between the junction of the cornea and the iris. So this is where the fluid exits the eye. So what happens in glaucoma? Glaucoma, what happens is either there is overproduction of this fluid. So you can compare it to a tap which is open too much, and the fluid is the water is flowing from the sides of the wash basin. So either there is overproduction which increases the pressure inside the eye, or there can be a blockage of the drainage pathway, which again leads to buildup of intraocular pressure in the eye. So when the intraocular pressure builds up, it compresses the optic nerve. The optic nerve is there in behind the eye, and when the pressure builds up, it causes compression or pressure on the optic nerve, and as the pressure goes higher and higher, the optic nerve fibers or the neurons in the optic nerve get damaged, and the patient can lose vision. So it is very, very important that we detect glaucoma on time and we treat it on time. So now let me go through a few symptoms which are present in patients who have glaucoma. Most of the times there are no symptoms. So most of the time when you go for a routine eye checkup, the doctor detects that there might be some problem in your eye. Your pressure is slightly high. So we should do some investigations, and that will confirm whether you have glaucoma or not. This is the usual mechanism or usual way where the glaucoma is detected in most, I would say 90% of the patients. But some patients might have these following symptoms. Say only 10% of the patients have these symptoms. One can be blurred vision, severe eye pain. Severe eye pain usually happens when the drainage of this aqueous is blocked. Patients can have headache. They can have rainbow colored halos. Like you can see when you see through a prism, you see those 7 lights, right? So similarly, rainbow colored halos, whenever you see light, can be one of the symptoms. Patient can have nausea and vomiting, colored rings around the light, or halos, which I've already told you. There might be sometimes, if the pressure is too high, there can be mild redness of the eye. And one of the other important things is frequent change of glasses. So when the patient goes to a doctor and changes his glasses, he will have a change of these glasses very frequently. So maybe every 3 months, 6 months, he might have to change glasses, because the pressure, intraocular pressure, if it goes high, that causes variation in the refraction of the eye very often. So these are the few symptoms. And the disease, glaucoma, progresses in this manner. In the early stage, as I told you, patients have no symptoms. They have no visual disturbance, and it is usually detected by the doctor. So once it is in the second stage, there might be some black spots in front of the eye. This is called visual field loss. So a patient has, one is the straight vision and one is the side vision. The side vision is known as visual field. And when glaucoma happens, the side vision slowly decreases. So the second stage, patients might have some decrease in the visual field. In the third stage, the visual field becomes very narrow. So the patient is not able to see on the sides, and he's able to see only things which are in front of his eye. And this is one of the very common symptoms which we see in patients who have very advanced glaucoma. Whenever they come to our clinic, they are able to see us very, very clearly, but they are not able to see any objects which are there on the sides, and they keep hitting their leg to the chair or to the sofa or anything which is in between. So they are able to see only objects which are in front of their eye. So this is usually the third stage, and in the end stage, patient can go blind. And usually with the modern advancement in medicine, this usually doesn't happen, but still it is very, very important that we be cautious, we take care of our eyes well. So there are, as I told you, there are different types of glaucoma. One is known as the open angle glaucoma. In open angle glaucoma, what happens is there is increased production of the aqueous or the fluid inside the eye. And because of the increased production, the intraocular pressure goes up, and this causes compression on the optic nerve, and this leads to visual field loss and ultimately blindness. And then there's a second type which is known as the closed angle glaucoma. In closed angle glaucoma, what happens is this usually happens in patients who have plus power or who have small eyeballs. So basically what happens is all the structures inside the eye are very narrowly packed, and hence sometimes one of these drainage pathways can get blocked. And once it is blocked, the pressure inside the eye raises. That is why this is known as closed angle glaucoma. Closed angle glaucoma basically means the drainage pathway or the exit route for the intraocular fluid gets blocked. And hence the patient might have symptoms such as headache, redness of the eye, blurry vision. And this If not detected on time, the patient can lose vision. So this is also very, very important that we keep a watch on this. So how is glaucoma diagnosed? Most of the times, glaucoma is diagnosed by when you go for a regular eye checkup. And one of the most important thing is glaucoma is a genetic disease. Let me put it forward. This is a genetic disease. Then you might have parents who would have had glaucoma, or there might be some ancestors who would have had glaucoma. So if there is any family history of glaucoma, make sure you get your eye checked up once in a year. This is very, very important, especially after the age of 40. So on a routine examination, we check the intraocular pressure or the inner eye pressure by a test called tonometry. Then the shape and color of the optic nerve is also examined. We usually do a dilated examination, and this test is known as ophthalmoscopy or fundus examination. Then once we have a suspicion that the patient might have glaucoma, we do a complete field test, or as I told you, visual fields. This test is known as perimetry. This is a very, very sensitive test, and this is the most important diagnostic test for glaucoma. Now, the fourth thing is the gonioscopy, where we see whether it is an open angle or a closed angle glaucoma. Like I previously told you, open angle glaucoma is a type of glaucoma where there is overproduction of fluid, and closed angle glaucoma is the type of glaucoma where there is obstruction of the outflow pathway. So this test gonioscopy tells us which type of glaucoma it is. And the thickness of the cornea, that is the test known as pachymetry. So after doing all these tests and checking the intraocular pressure, as an eye doctor, I come to a conclusion whether the patient has glaucoma or not. Glaucoma is usually treated, the first line of management, as I told you, is by drops. We have wonderful drops, and a few of these drops are manufactured by the Santen company also. They are the number one company in Japan who manufacture glaucoma as well as dry eye drops, and glaucoma is usually controlled by these drops itself. Once, if the drops are not effective, then there is a treatment known as laser treatment. It's not a laser surgery, it is just laser treatment, which is an OPD procedure. So the patient need not fear that he's undergoing a surgery. It is just an OPD procedure. The patient can just come, get the laser done. There are different types of laser depending upon the type of glaucoma, whether it is an open angle or a closed angle glaucoma. We have various treatments such as argon laser trabeculoplasty, the iridoplasty. Then we have micropulse diode treatment, which reduces the intraocular pressure. And sometimes we can use a YAG laser to do a peripheral iridectomy. So by all these techniques, we reduce the intraocular pressure. That is the whole goal of the treatment for glaucoma. And if nothing works, if the drops don't work, if laser doesn't work, then we think about surgery. In surgery, what we do is, the outflow, the production is either more or the outflow pathway is obstructed. So we have to create an alternate pathway. Now this is known as a filtration surgery. And this is done on the external part of the eye, where we create an alternate pathway for the intraocular fluid to come out of the eye. And it is well covered with the skin of the eye. So this is known as filtration surgery, or we also call it as a shunt surgery. In simple words, it is an alternate pathway which we create for the intraocular fluid to come out of the eye. So who are at the risk of glaucoma? All people above the age of 40, people who are using steroids for a long duration for any other diseases of the eye, such as uveitis, or even patients who have undergone cataract surgery sometimes use steroids for the long time. Patients who are high myopic. Myopia basically means patient who have very high minus power or very high plus power. These patients are at a very high risk of glaucoma. Patients who have high blood pressure or diabetes. This is the other common thing is family history of glaucoma. This is very, very important. So I suggest everybody whichever patient comes to me with the disease glaucoma, I always tell them that it's very important that you get all your family members examined. It is very, very important. Patients who have some thinning of the optic nerve are at a high risk of glaucoma. Patients who are having high intraocular pressure, have had any history of eye injury, or patients who have thin corneas. Now, these are all the risk factors for glaucoma. So to end my talk, glaucoma, I'll just put glaucoma in a small nutshell. To summarize, glaucoma is a disease where some patients have very high intraocular pressure, and this is seen in almost 95% of the patients. And 5% of the patients, the intraocular pressure is normal, but still there is compression of the optic nerve, and this can cause optic nerve damage and visual field loss and loss of vision. So this is the sequence of events. Due to the raised intraocular pressure, there is damage to the optic nerve, as I previously told you. And once optic nerve damage happens, initially you lose your sight of vision or the visual field or side vision, and when it is more advanced, you even lose your central vision. So this is something which you have to keep in mind. So what we need to do, if you are above 40, or if you are above the age of 40, and if you are wearing plus or very high powered minus or plus glasses, have been using steroids, if you have family history of glaucoma, please get your eyes tested every 6 months to 1 year. It is very, very important. And if you are already a patient of glaucoma, use the medications which the doctor has given you regularly without fail. Because it is okay if you forget a meal. That is still, it will be considered as if you're fasting or you have upas. But make sure you don't miss the glaucoma drops. You should periodically get your eyes checked every 6 months to 1 year. And whenever the doctor does the eye checkup, he will generally advise you to undergo 2 tests. One is called the field test. That is very, very important, which will tell us whether you have glaucoma, and if you're already a patient of glaucoma, it will tell us whether the treatment which we are giving is working or not. It is something like a diabetic patient, always checks his sugar, right? This is how we find out whether the sugar is controlled or whether it is under control or not, whether the medications the patient is taking is working for him or not. Similarly, we have to do a perimetry and an OCT. The OCT is something like a CT scan of your optic nerve, which will tell us whether your optic nerve is getting damaged or not, and whether the drops which we are putting are working well for you or not. So this has to be done every 6 months to 1 yearly. And if you you have to make sure that if you have glaucoma, please take all your family members for an eye checkup to make sure that they don't have glaucoma. Vision loss is something which cannot be regained. Whatever you have lost in glaucoma is lost. But at least if we treat you on time, if we detect the disease on time, and if you apply the medications properly, then we can preserve whatever vision you have. So timely diagnosis and appropriate treatment are the key for glaucoma prevention. Thank you, one and all. Before I finish, I would just like to show you a small stimulator on YouTube, which will tell us how you have experienced this kind of visual loss. See, you can see in this video that you have a black spot. So this is how a patient with, I would say, second stage of glaucoma experience in his visual field. And as your glaucoma progresses, this black spot will keep on increasing. So you have to make sure you cannot live a life with a black spot in front of your eye. That is going to be very, very disturbing. So make sure that you get your eyes checked regularly, especially if you are above the age of 40. And if you have any family history of glaucoma, make sure you get your eyes checked. So basically, your side vision is going to slowly come down, and at the end of the disease, you're going to just have the central vision. And in very advanced or last stage of glaucoma, you're going to lose your vision. So make sure that that doesn't happen. That brings me to the end of my talk, and I'm ready to take any questions, Mr. Rahul. Mr. Rahul? Mr. Manigandan?
Yeah, sir, sir. So actually, so far,
I hope it was an informative talk.
yeah, sir. Really, it's good talk, sir.
Thank you. Thank you.
Really, it's very useful for your patients, doctor.
I should thank you, because see, you have taken all these efforts to organize a program like this, to inform people what is glaucoma and how to detect it, how to treat it. So it is very, very important. I should thank you also.
Thank you, doctor. Thank you, sir. Sir, any questions? Please dictate your patients, sir.
Yeah.
Yeah, regular
questions. Any questions? I can see some questions on this chat.
Yeah. Already he shared by chat box, sir. Please go ahead, sir.
Is glaucoma a congenital disease? This is one of the questions which has come up. Yes, glaucoma runs in the family. So it is a genetic disease, I would say, or a congenital disease, you can say. So patients whose parents have glaucoma, it is always better to get your eyes examined, especially if you're above the age of 40. Make sure, and if you're a diabetic or a hypertensive, it is mandatory that you get your eyes examined. And if you are detected with glaucoma in the early stage, make sure you adhere to the treatment. Usually, most of us as doctors, we prescribe drops, and there are wonderful. See, when I would say 35, 40 years back, there were not many options or drops available for the treatment of glaucoma. There are only 1 or 2 drops, and hence the surgical treatment was forming the main line of treatment if the pressure was not under control. But now there are different types or different varieties of drops which are very, very effective, and hence if you apply the drops, you can preserve your vision. Rahul ji? Yeah.
Yeah, sir.
So there is one more question which one of our viewers have asked is, what is the chance of a person losing vision in glaucoma? Okay, now this is a very, how do I say, subjective question. If the disease is detected early, अगर बीमारी जल्दी पता चल जाए तो उसका टाइम सर इलाज हो सकता है, और अगर टाइम सर इलाज होएगा तो नजर अपन बचा सकते हैं. So if we detect the disease on time, we can save your vision, we can preserve whatever vision you have. So for that, you have to go to the doctor and make sure that the doctor does all the tests, and if you have glaucoma, he will put you on drops. And with the regular checkup and with the regular usage of drops, you have to go for regular follow-ups, and if your vision and your visual fields, everything is maintained, then there's nothing to worry. If the visual fields or your intraocular pressure is not maintained well, then you can think about laser or laser treatment or surgery, which is the final resort. But something has to be done to make sure that the intraocular pressure inside the eye is controlled. So yes, there is a chance of losing vision, but if you detect the disease on time, then definitely you are not going to lose vision. Definitely not. Okay. There's one more question. Now, what is the best type of treatment for glaucoma? Okay, now this again is a very subjective question. That depends upon the stage of the disease and the intraocular pressure control. If the intraocular pressure control is good with drops, most of the doctors, most of us, we will definitely choose drops for our patients. If the intraocular pressure is not, been getting maintained with drops, then we can think about laser treatment or surgery as the final resort. This is the usual way glaucoma is treated. Nobody will, resort to surgery immediately. It depends upon 2 things. One is the stage of the disease and the control of intraocular pressure. These 2 things will decide whether we have to continue with the drops or we have to change the way we are going to treat the patient with glaucoma in that particular patient. Any other questions?
Sir, one more question, sir. For any food restriction for glaucoma patients, sir, particularly?
Our diet has nothing to do with glaucoma. Generally, we have to take a healthy diet. A person who takes healthy diet is going to have a healthy eye also, which is very essential to maintain the health of the optic nerve, because optic nerve is something which is damaged in glaucoma. So apart from your usual medications, take a healthy diet, but there is no dietary restrictions as such or any particular form of diet which is going to increase the pressure inside the eye. So there's nothing like that.
Thank you, doctor. Thank you, sir. Yeah, fine, sir. No more questions.
Okay.
Thank you, sir. Yeah, hello, doctor. We will close the session, sir.
That brings us to the end of the session, and I thank one and all for attending the session. And if you have a family history of glaucoma or anything, please get your eyes checked. That is one thing. And second thing is, just because I'm on the public forum today, I would also request that again the corona cases are slightly spiking up. So make sure you take care of yourself, wear your mask, and if possible, please get vaccinated. That is very important. Please get forum today. I would also request that again. Thank you.
Thank you, doctor. Have a good day, sir. Thank you. Thanks, sir.